Hi everyone, my name is Laura Wisse and today I'll be talking about the quality assessment of T2-weighted images specialized for MTL segmentation. And I actually get asked a lot the question of how to assess these images. And the quick answer to that is to just scroll through it and determine if you can see all the boundaries that you need for MTL segmentation. But I realize that it's complicated to assess if you don't have a lot of experience with MTL segmentation. So I'll just go through a couple of images today and explain to you how I go about it. So the first one is opened here, and you can see that the image looks actually pretty sharp, although you see some lines here, so maybe there's some motion on the top, but in general the MTL looks pretty good. So I'm gonna zoom in on the left MTL. And so this is medial, this is lateral, this is the amygdala, the hippocampus, and adjacent regions. So I'm going a little bit further anterior. So here I can see the borders of the hippocampus pretty well. Similarly for the extrahippocampal regions, and I generally go up to the second sulcus, the occipitotemporal sulcus, and I can see the borders really well. So this would absolutely be good for segmentation. So going a little bit further, again I can see the outline of the hippocampus very well. I can see this inner dark band, the SRLM, and I can also see the borders of these cortical regions very well. Going a little further posterior again, I can show you the outline, which is pretty clear here. It's a little darker here, but I think it's okay. So this would be good for segmentation. And then the second border that I'm interested in is this dark band, which is also very clear in this image. So going a little bit further posterior, again, you can really clearly see the dark band. I'm doing it a little bit messy now. And also the outer borders to the sulcus here. And go a little bit further. You can still see a little bit of this that you saw in the previous slice. It's a little bit, I guess, smooshed here. I don't really know the correct term for it, but that's pretty common with the posterior tip of the uncus. And then again, these adjacent regions look pretty clear. The border here is clear, as well as the dark band in the middle. So going in a posterior direction, same thing. This border is clear, this border is clear, all the way up to the second portion of the cortex. Again, I'm doing it a little bit quickly, and obviously if I'm looking at these images for quality assessment, I'm not outlining that, but I just do that in my head. Going in a posterior direction, you can still very clearly see all these borders. Okay, same here. So I can still see all these borders. If you go all the way posterior and you're in the hippocampal tail, sometimes I don't really see the borders, the dark band within the hippocampus, but as I'm personally not segmenting the hippocampal tail into subfields, that's not really important for me. If you do want to segment subfields, you should really check for that, because generally in the tail we have a lot more partial voluming and the dark band may become obscured. And then all the way to the end, this is still hippocampus and adjacent regions, but I think in general this is a pretty clear, sharp image which I would include for segmentation. So now we're going to go to the second example. If you look at the overall image, you can see again maybe some lining here, indicating that there might be some motion, but I think the MTL looks pretty good. So we're going to go again through the image from an anterior to posterior direction. So going anteriorly, you can see the hippocampus again. So it's a little bit harder here. This image is a little bit noisier than the previous one, but I can still see this dark band surrounding the hippocampus, this dark layer, I should say. And I see the dark band in the middle. And I can also see the borders of these extra hippocampal regions. Although again, it's a little bit less sharp, but I think I see them well enough for segmentation. Okay, going in a posterior direction, again, I can still see the borders of the hippocampus clearly, up to the second sulcus here. Again, I'm doing this a little bit quickly. And I see the dark band as well, although it's not super clear, but I definitely see portions of it. It's more or less like this. Going a little bit further posterior, again, the dark band is there. It's not clear everywhere, but it's pretty clear. It would be like this, and the outer borders of the hippocampus and the extrahippocampal regions are pretty clear. And this is a vessel, I want to point that out. So going further posterior again, you can pretty clearly see the borders here, although it's a little bit noisy. And then again, the dark band would be this one. And these adjacent regions are also pretty clear. Going further posterior, again, this ungual region doesn't look as sharp anymore, but I think it's still clear enough. The outer borders are pretty clear of the hippocampus, and this dark band is becoming more and more clear. And I think in general it's the case that in the hippocampal body, the images look generally a little bit better than in the hippocampal head and tail. So unless you're only segmenting in the hippocampal body, I would recommend seeing or looking at the whole image before you decide to include or exclude it. So again, I can see the borders, the cortical regions, and the hippocampus, and also this inner dark band. And going a little bit further posterior, it's really sharp here. And also the outer borders, and so forth. Still here, and then again, if you go again to the tail section, the dark band becomes a little bit more obscured, but again, for me, that's not an issue. So I would also include this image, even though in some of these earlier image slices the dark band is not super clear. I think it's only on 1 or 2 slices, so I think this is good enough to include it for segmentation. So I'm going now to the third case, and if I look at the whole coronal slice, you can already see a lot of the lining. So there's quite some motion, and you can also see actually quite some motion in the medial temporal lobe. I'm gonna look at the right hemisphere now. So you can see the medial side here, the lateral side here, and so this is more or less the hippocampus, the amygdala, entorhinal, perirhinal, but you can see a lot of lines going through it, which I think make it very hard to segment this region, because I'm not sure if this is actually a boundary or an image artifact. So going in a further posterior direction, I'm just looking at the extrahippocampal regions now, and I see a lot of lining, the borders are not clear, and so forth here. So I would personally exclude the extrahippocampal regions for segmentation, because I'm just not so sure that I can see the borders. And this, you can even see the lining go through, like the collateral sulcus here, and this continues to the ends. So I want to scroll back now for the hippocampus, and actually that's something I recommend. If the image is pretty bad, it might be helpful to first focus on the cortex and then on the hippocampus, or the other way around, just because it might be difficult to pay attention to all the different regions at the same time. So I can see the hippocampus a little bit here, but it's not very clear and it seemed to be kind of smooshed out. So same here. I can't really see the outer borders very clearly, but also not the inner borders. Here it's becoming a little bit more clear. And I can even see the dark band here. But then a few slices later, again here I'm not so sure what I'm seeing, and I'm seeing some lining through here. And here I don't see the inner structure very well. Maybe this is the dark band, but I'm not 100% sure. So given that I see now quite a number of slices where I'm not 100% sure, I would probably also exclude the hippocampus. Even though there are actually some body slices where you can see the outer borders, but also the dark band pretty well. So there are always, as I mentioned before, the hippocampal body generally looks better, so there are generally some slices where you can see something, but given how bad the hippocampal head looks, and that's something that I do segment, I would exclude this for hippocampal subfield segmentation. So I want to go to the last slice, and you can already see that this one has a lot of motion, again a lot of lining, and then going anterior in the, let's do the left hippocampus and medial temporal lobe. You can see that it's very hard, I mean you can see some of the structure, but it's very hard to determine the borders and also to determine the inner structure of the hippocampus. So I can pretty easily say that this one is not acceptable, at least for me, not acceptable for segmentation. So I hope this was helpful, and thank you for listening.